And towards the end of our program, we have an exclusive interview with the WHO Country Office Director in Georgia, Silviu Domente. As I remember, this time the focus of your interview was more on structural challenges that more broadly the health system in Georgia has. Am I right?
Totally right, Georgi. This time Silviu Domente will be focusing on the recent WHO report, which among other things recommends to regulate prices on medicine in Georgia. The reason for that is the financial burden that this component creates to the individuals and households, since the share of out-of-pocket payments is the highest on medicine. Of course, we challenged Mr. Domente with different points of view and analysis, and our readers and followers can now follow this part of the exclusive interview in detail as well. What are some structural challenges that WHO sees in this system and is advising the government on this?
WHO is promoting very actively the principle of universal health coverage. And when we say universal health coverage, to put it simple, it means that the people need to have access to services in the volume they need, at the time they need, at the place they need. Those services should be of high quality, and most important is people should not experience this financial hardship from accessing services, and people should not get impoverished from accessing health services. These are the main principles, and the whole structure and the whole organization of healthcare should follow these goals. I mean, people need access to services, those services should be of high quality, and people should not experience financial hardship. So that's why we looked particularly in this aspect of financial hardship, because it's very, very important. And we know that this financial hardship usually is caused by the out-of-pocket payments. Yes. That people have to pay for services out of pocket in addition to what the state can cover for them. And this usually, when out-of-pocket payments are very high, then people this can lead to so-called catastrophic payments for health services and to impoverishing expenditures for health services. So evidence shows that the lower the state allocations for the health sector, the higher the out-of-pocket payments. So, and unfortunately, Georgia still allocates quite a modest amount for health. This has increased, of course, and you know that since 2013, Georgia introduces universal health care program. So the state allocations for health have increased significantly. This has led to improving access to health services. So from 20% of people accessing health services previously, now almost everybody has access to this universal health care program.
For the last 6 years, there hasn't been a year when universal health care doesn't need additional spending for the budget. It is always breaching the threshold that it has in the state budget.
That was exactly my point, because Georgia has increased budgetary allocations for health, but they are still very low. So now this is around 2.8% of GDP paid for health, while in the whole European region, the average is 4.9, almost 5%. And when I say European region, it's not European Union, but European region of WHO, which is 53 member states, including former Soviet Union, Central Asia, and so on. And if we look into the EU, then this is around 7% of budgetary allocations go for health. So if we compare with 2.8%, it's very modest. And actually, Georgia is allocating less for health among the countries that allocate least for health. This is of course a concern, and since few years we are promoting this increasing budgetary allocation for health. It's important, but simply increasing allocation, of course,
that was my next question,
will not solve all the problems, because it's important how you allocate, where you allocate those services, and how you design these services, because whatever you allocate, there will always be like co-payments for different services. So nobody, no country in Europe now can fully cover 100% all the services. There are always co-payments and there are always out-of-pocket payments, but it depends how high these out-of-pocket payments and what is the impact on household budgets. This is the problem, because when out-of-pocket payments are low and when it doesn't have a strong impact, a severe impact on household budget, they are fine and they are acceptable. And in most of the countries, these out-of-pocket payments are around 15%, maximum to 30%, which we in WHO consider as a threshold. So in Georgia, these out-of-pocket payments reached 48% now, which is again one of the highest in the region. And this is, of course, an issue of concern. And we did this study and we saw that despite this universal healthcare program, despite increased allocation and increased access to services, still out-of-pocket payments have increased. The share of out-of-pocket payments in the household budget has increased from 7 to 9%. So people pay more out-of-pocket for services. And on the other hand, 7% of the households, they have these impoverishing payments and 17% catastrophic payments for their household budget. So this is an issue of concern.
The biggest share of these out-of-pocket payments is medicine, right? And that's why your focus goes on medicine and medicine prices.
That's right. When we look at those catastrophic payments, so almost 70% of those out-of-pocket payments, catastrophic payments, they go for medicines. And if we divide the population in quintiles, so the poorest quintile pays even more. The poorest quintiles pay out of 90% for catastrophic payments for medicines. In the richest quintiles, it's much less, 24%, and so on.
Speaking of Georgia's context, when we see that majority of medicine is imported into the country, the first thing that comes to mind is even more liberalizing the rules and restrictions on imports, so that helps to lower the prices. But I haven't read any of that in the last report of WHO. You are stressing on regulating prices directly. Why is that choice, and how will that work?
This is a good practice all over the world and in the whole region. So the evidence shows that when people regulate better the pharmaceutical market and the prices of medicines, so this leads to better financial protection, because at the end this leads to better prices of medicines. At the end, this leads to better quality of medicines and many other aspects. So here it's not only price regulations alone. Of course, price regulation is very important, and here in Georgia, so I must say that the prices are not regulated. They are liberal, as you yes. mentioned, but this doesn't help to reduce them, because Georgia is a small market and it's not always possible. Then Georgia is a country that is using increasingly brand names, and the generics medicines are in very low quantities on the market, and they are not popular both among doctors and population. So this is another issue. Then the issue of quality of medicine, quality assurance, but then also how people get reimbursement for medicines, all these schemes, how much is people get reimbursed from the medicines that are prescribed. So, because in different countries we have different schemes, and this is also another issue. It's not only about prices, but also many other aspects. I want to mention this. And the first thing we recommend is, of course, to have a framework legislation, a new legislation in the area of pharmaceuticals that will open the possibilities to better regulate prices, to better regulate quality, access to medicines, and so on. And the second direction is how to how to reimburse these medicines and what medicines to include in the package of services to be reimbursed by the state. And here, first of all,
so that they are included into the universal health care.
And we have here to look at the burden of disease, because in Georgia 95% of mortality is caused by non-communicable disease. So it means that we have to include in the package of services more medicines for chronic diseases, non-communicable diseases, like for hypertension, for diabetes, for asthma, and so on. And this is very important step. And then how to reimburse, how people to get reimbursed, because for the time being, so there is a percentage payment for the medicines that people have to pay out of pocket, and there is no cap how much people can pay out of pocket during the year. So there are no limits. People can pay, and then to regulate and the volume of services provided, the prescription of medicines, and so on.
Because if the focus is only on regulating prices, here I see the risk that some medicine might not be available on the market, and that's it. Once again, because most of it are imported, and you know that, Larry, depreciation is a very strong factor here. Also, if we just artificially lower the price, some medicine might vanish.
These are, yes, the usual arguments of the pharma industry, and there is some truth in that. In some cases, so some big pharmaceuticals companies, they can withdraw from the market, but the practice has shown that there is never an empty place in the market. If any producer withdraw from the market, somebody else will come back. This is for sure. So we have seen this everywhere. It depends again on the state and how this is regulated, and how this market is opened, and